Have you ever wondered what it's like going to see a registered dietitian one-on-one? This video is going to tell you all about what initial and follow-up appointments look like. Stay tuned. Hello friends! If you don't know me yet, my name is Libby Parker. I'm a registered dietitian and I specialize in helping people recover from eating disorders. So in today's video, I'm going to cover one of my most frequently asked questions from people who have not yet seen a dietitian. And that's, what does a session look like? What does an initial session look like versus a follow-up session? And what can I expect? A lot of people are super nervous seeing new healthcare professionals, whether it's a dietitian, a therapist, a doctor, whatever. Like, I get it, it's nerve-wracking. I'm always a little nervous going to see a new healthcare provider myself. And so I wanted to make this video and cover some kind of just basics of what to expect when you're walking into a dietitian's office to work with them one-on-one. Now, of course, disclaimer, this is my take on it. Although most dietitians have a very similar framework, obviously it's going to vary from individual to individual. We all run our practices a little bit differently. If they work for an organization, they might have to do things a certain way. So what I'm saying, a lot of it is general knowledge, some of it is specific to me, so take that into consideration. Okay, so what is an initial assessment like when seeing a dietitian? Most of what I talk about today is going to be through the lens of seeing a new client with an eating disorder, but I'm going to try to make it as generic as I can for whatever reason you're going in to see a dietitian. So before I have someone come into my office, usually there is some sort of communication on the front end, whether it's a referral from another provider or the client is reaching out to me themselves. We're going to have a little communication, usually through email, maybe a phone call, to make sure that we're going to be the right fit to work together. So I think that's super important because everyone has a different style, a different vibe, different things they're looking for, and providers have, their own way of educating people, different things they specialize in. So like if you have diabetes, you don't want to see me. I'm not the person for you. But if you have an eating disorder and you're on an outpatient level, please come see me. If you're a performer, please come see me. Like, that's who I love working with. So once we determine that you're going to be a great fit to work with me, I will send some forms ahead of time to fill out. So at this point in my practice, I have taken pretty much everything online, so there's no papers. Very green friendly and all that, but I'll send you a unique client portal link where I have all of the documentation stored in a secure cloud-based electronic health record. So it's all HIPAA compliant and all that stuff, so you don't have to worry about any of this information getting out. So in my initial intake questionnaire, I'm going to be asking a lot of questions to help me get a better sense of what you're coming in for, where you're at, what your background is, and any health issues that you have. So some of the main questions I'm asking are, what brings you to nutrition counseling now? Like, what are you looking to get out of it? What are your goals? And it's okay to not write a novel here. Some people will give me their life story in a couple paragraphs. Some people write to recover from my anorexia. Like, it can be kind of whatever, but it's nice to have some detail. I'll also ask if you have any current medical or mental health diagnoses. Super important for me to know if you're, one, working with another provider like a doctor or therapist or psychiatrist, if you have diagnosis. If you have certain diagnosis, it's going to change how I'm going to interact with you. So it's really helpful. Like, I had a client recently who has chronic migraines, so I make sure to keep the lighting really low in my office when she comes. And she didn't ask me to do that. It was just something that from her intake I was able to gather, and she really appreciated that I kept the lights lower. So it all is going to help. Also, certain medical and mental health diagnoses make a big difference in what food information I'm going to share with you. There are definitely dietary things to consider with certain health needs. So I want to make sure that I'm giving you correct information for what you've got going on in your individual body. Other questions I'm going to ask, are you on any medications or supplements or anything like that? Whether they're prescribed or not, I want to know everything that's going into your body so I can make sure that I can double check that things aren't going to interact weird. Are you taking stuff that doesn't make any sense, hasn't been, evident, there's no evidence-based proof for it. So we can talk about that, make sure that you're not taking things that are going to conflict with each other, like all that kind of stuff. Yes, your pharmacist should be looking at this, but if your pharmacist is only looking at your prescribed medications and not the fact that you're taking some other like powder you found on the internet, like they need to know that too. So I want to know all of it. Other things, any health history, so yours and your family's, so are you at higher risk of stuff? Do you have a history of certain things that have gotten better? Have you had any major surgeries that are going to affect the way you digest and process food? Like, all super important to know. Other things, are there any dietary restrictions that you follow, whether religious or otherwise? So are you kosher? Are you vegetarian? Do you, all the different things. So I want to know if there's anything that we need to be aware of, and is it based in a religious ethical reason, or are you doing it as like a health fad? We're going to try to suss some of that out as well. I will also ask some demographic questions and things like height and weight. I don't care if you know your weight. If weight is something that is triggering to you, or you're trying to get away from weighing yourself, and you don't want to know, like, don't weigh yourself. Like, that is the least important thing about you. But it does, if you already know your weight, if you've had it taken recently, if you are someone who weighs yourself every day currently, like, we're going to work on that. But I may as well know the information up front, and then I don't have to weigh you. So that makes that easier. Okay, so that's a lot of the forms going in. So like you can see, we've already covered a lot. I read these things thoroughly before you come into my office because I want to make sure that we can hit the ground running when you get in there. Okay, so your first session with a dietitian. Yikes, exciting, scary, nervous, all the things. So especially since I work with eating disorders, but hopefully in any kind of nutrition situation, I want to know as much about you, your background, your lifestyle as possible. And that's going to help me make more informed decisions about things we need to work on, education, goal setting, what foods you like and dislike, where are you at? So the first session is primarily me asking you questions and you talking a lot. And I know this can be intimidating, but it's really, really helpful for me. So if you have, for instance, a history of being in treatment centers for your eating disorder, I want to know about that. If you started dieting when you were 6 years old because of something your mom said, I want to know about that. I want to know your food environment currently. Are you afraid to go out to eat with people? Do you have access to a working kitchen? Are you food insecure? What is kind of your daily routine with food and exercise right now? I want to know all of these things. So we're going to spend 90% of the first session just gathering that information. And that's going to make it really helpful for subsequent sessions. Now, I know it can be really intimidating to tell a stranger like super intimate stuff about yourself and your life and your food beliefs on your first meeting. I totally get that. Like, you don't trust me yet and I don't have all the right questions to ask you. It's tough, but know that it's confidential. Nothing is leaving the room unless you're going to be a harm to yourself or other people. So this is a place where you get to have that safe space that you just don't get in other areas in your life. So please open up to your dietitian. And I know that not everything gets said in the first session, so if other things come up or you feel more comfortable saying something after a few sessions, bring it up. Like, we're not going to know all the right answers or questions to ask you. So definitely be on top of that. Okay, so we're going to wrap up the first session with setting usually 1 to 3 goals. So typically I like to set really small achievable goals with people and talk through ways to make them actually happen. It's one thing to say, hey, you need to drink more water, but how are you going to do that? Okay, we're going to talk through what's going to work for you in your life with your achievement style to make that happen. Like, do you love checking things off a list? Do you need things to be really visual? Do you need audio reminders? Like, what's going to make these things happen? So we're going to work through strategies to make these small goals happen. And then when you come back for a follow-up session, we're going to troubleshoot on what worked and what didn't work with those goals. See if we need to do any more ideas or education around that and set new goals. Okay, so that was the first session. Follow-up sessions are all pretty much the same format as each other, but obviously you're going to be working on new goals, new education, new skills. So subsequent follow-up sessions are going to be primarily education based. So again, we're going to be going through your goals, what worked, what didn't work, what information do you need to know to figure out how your body works. I am a huge component of if you learn more, you're going to be able to apply it better. And when you teach other people, it's really helpful as well. So if there's something that you can teach back to me, you can teach to your family so that you're all working on something collective together, that's going to make you much better at achieving your goals. So again, at the end of each session or throughout the session, we're going to be working on setting small achievable goals, working through how to make them actually happen. So I try not to set more than about 4 goals per session because I want you to actually do them, and if you leave with the list as long as your arm, you're not going to get them all done. So that's pretty much what you'd be expecting coming into my office doing an initial and a follow-up appointment, and I think this rings fairly true for most dietitians. If you have more questions, please leave them in the comments below, email me, let me know. I would love to do more Q&A type videos like this. So if you like what you're seeing here, please click the subscribe button below. I would love to have you in on my channel. I do education on health, eating disorders, body image, and other relevant topics as they come up, and they're coming out every Wednesday right to you. So click that little bell icon to be notified when the next video comes out, and I will see you then. You can buy Permission to Eat on Amazon.com and anywhere else that you like to buy books online. I hope that you'll join me, and I know that you've got this.